Hi, my name is Flavia Vitale, and I'm an assistant professor of neurology, bioengineering, and physical medicine and rehabilitation at the University of Pennsylvania. Today, I will tell you a little bit about our research work on engineering novel bioelectronic technologies based on two-dimensional nanomaterials. But before I start talking about my research, let me take 5 minutes to tell you a little bit about my career journey that took me from Rome, Italy, to all the way to Philadelphia to start and direct my own research lab. So I was born and raised in Rome, where then I got my bachelor's degree in biomedical engineering, followed by a PhD in chemical engineering at the University of Rome La Sapienza, which is one of the oldest universities in Europe. In 2012, I moved to Houston to complete my postdoctoral training in chemical engineering at Rice. And at Rice, I worked on novel carbon-based nanomaterials, in particular carbon nanotubes and graphene, and investigated application of these materials for biomedical uses like neuroengineering, as well as cardiac electrophysiology. Then in 2018, I started my own research lab at the University of Pennsylvania. So here we are developing novel bioelectronic technologies to study, diagnose, and treat neurological and neuromuscular disorders. Our ultimate goal is to translate these technologies to the hospital and improve patients' lives. To accomplish this goal, we adopt a multidisciplinary approach, combining fundamental studies of nanomaterial properties with the development of custom manufacturing processes to integrate these materials into functional devices. And we then use our devices to research neural function and disease in a number of in vivo models, ranging from small animals all the way up to humans. Some examples of these technologies include wearable and implantable sensors for clinical monitoring and diagnostics, as well as small microelectrode arrays for basic science studies of neural function and disease. So the term bioelectronics broadly refers to a class of devices engineered to treat, restore, or replace electrically active circuits in the body and address the societal and economic challenges posed by many neurological and neuromuscular disorders, such as Parkinson's disease, epilepsy, and chronic pain. Some of these technologies, such as electrodes for brain and cardiac monitoring or deep brain stimulators for Parkinson's disease and epilepsy, have been used in clinical practice for decades, but some others, like brain-computer interfaces, hold the great promise of restoring lost motion and sensation due, for example, to amputation or injury, but are still in the research realm. Regardless of the specific application, all of these technologies rely on an interface between man-made electronic components and biological systems. And despite years of research, there is still an unresolved issue that severely impacts the performance of bioelectronic devices, which is the fundamental mismatch between the physical, chemical, and electrical properties of these two domains. So biological tissues are soft and compliant, they are dynamic and moving, and think about how your heart pulses and expands at every beat. Bioelectrical signals are carried through a flow of ions in a fluid, and all materials are organic. Traditional bioelectronics, on the other hand, are rigid and static, and these devices typically rely on inorganic materials like silicon and metals, and signals are carried through flow of electrons or holes. And finally, manufacturing these technologies is time-consuming and expensive because it relies on processes that were directly borrowed from the semiconductor industry. In recent years, nanomaterials like carbon nanotubes, graphene, nanodiamond, and MXenes are emerging as promising alternatives to metals for safe and long-term stable bioelectronics. The main advantages of nanocarbons are in the broad range of properties such as the high electrical conductivity, their softness, the low density, the magnetic properties that are much closer to those of tissues than metals. And also these materials can be easily functionalized to enhance or add functionalities. And in addition to the peculiar material advantages, these nanomaterials can be easily processed into the final devices with high throughput, low cost manufacturing, such as inkjet printing or direct laser writing. In the last few years, in my lab, we have been extensively investigated the use of carbide vaccines for bioelectronics. The term vaccines broadly refers to a family of two-dimensional nanomaterials composed of a carbide a carbon or nitrogen core surrounded by transition metal atoms and a surface that is decorated with oxygen, hydroxyl, or fluoride groups, depending on the synthesis process. And so of more of the 20 forms of vaccines synthesized thus far, we have been particularly focusing on titanium carbide vaccine, or Ti3C2, because it has a very interesting properties. In particular, it's highly conductive and also has a high electrochemical capacitance, which is advantageous for application in bioelectronics. Now, what makes Ti3C2 vaccine unique among other carbon-based nanomaterials is that it is hydrophilic and stable in aqueous environments without any treatment or surface functionalization, which means that we can take vaccine dispersed in like water and make this like very safe aqueous inks that we can use for print the devices onto soft polymeric substrates at room temperature in a way that is safe not only for the materials, but also for the operators. Since Ti3C2 vaccine is a relatively new material with no precedent in bioelectronics, in the early phases of this work, we had to do a lot of work to develop a process to reliably produce implantable bioelectronic devices from vaccine. The process, which we conduct at the Pensing Center for Nanotechnology, consists in a sequence of conventional microfabrication steps, followed by dispensing the vaccine ink onto the flexible substrates to pattern the microscale features on the polymeric substrates. And using this process, we successfully produce microelectrode arrays with different geometries. So the first one is a planar device with all vaccine contacts to record brain signals directly on the surface of the brain cortex. And the second configuration is a penetrating electrode that is implanted inside the brain with vaccine contacts closely spaced to gold contacts. And we chose this design to conduct side-by-side comparison of the recording performance between vaccine and gold, which is a material that is extensively used in these devices. So when we recorded the brain signals in vivo in rat brains, we found that because of the higher conductivity and the higher capacitance of vaccine, we had a much higher sensitivity, lower noise, and broadband improvement in the signal-to-noise ratio when we recorded the brain signals, which consists in this very fast and small negative deflections that are generated, or spikes that are generated by the neurons around the electrodes. And we found, because of the higher sensitivity, that actually we could record a much larger number of spikes on the vaccine compared to the gold contacts. Now, because no one had ever used vaccine before in contact with neurons, we also tested the safety of vaccines to neurons. And what we found is that after culturing neurons on vaccine films for 7 days, and for comparison onto a plastic tissue culture plate, we found an equal number of, or very significant, or very similar number of viable neurons on the vaccine films compared to the control. But not only that, we found that neurons could proliferate and form functional connections, so functional networks on the vaccine substrate, which supports the finding that vaccines are not only safe, but it can actually can support neuronal growth and proliferation. Now, microelectrode arrays are powerful tools to conduct basic science, neuroscience studies in small animals, but really cannot be used in humans that have a much larger brain. In humans, what is most commonly used are epidermal electrodes or skin electronics. These devices consist in electrodes placed on the skin, and these electrodes record the electrical activity generated in the circuits underlying the skin surface. These devices are used for diagnosis and monitoring, and also treatment of some neurological and neuromuscular disorders, but also for fitness, tracking, and entertainment. Think about brain-controlled drones or video games. Example of these devices are muscle sensors, or EMGs, which can be used to diagnose and treat muscle spasticity and pain, brain electrodes, or electroencephalography, which can be used to diagnose epilepsies, sleep disorders, and brain injury, or cardiac electrodes for electrocardiography, or ECG, which is used to monitor heart function. So in all of these devices, the skin constitutes a barrier for recording the signal of interest, because of the layer of oils and fat on the skin effectively insulates the electrodes from the signal of interest. And so there are like main strategies that are commonly used to overcome the skin barrier and improve the contact between the electrode and the skin. So examples of these solutions are conductive gels in between the electrode and the skin, but these are like irritating, uncomfortable, and actually potentially toxic. Or the other solution is to make the electrodes larger, but this is like, again, uncomfortable for the patient, and also these electrodes have a much lower spatial and temporal resolution. So to evaluate whether MXene could also address some of the resolution and comfort issues of this human scale bioelectronics, we developed a rapid, high throughput and high yield fabrication process for making large scale devices, still based from this MXene aqueous inks. The process, very briefly, consists in laser cutting the electrode contacts, then followed by inking these contacts with MXene. And then the whole device is encapsulated in a soft polymer material like silicone. Now, for application in non-invasive brain recordings, or EEG, where there's a hair between the scalp and the electrodes, we slightly modified the device design to add three-dimensional mini pillars on the contact sides and overcome the hair barrier. And so this process, in addition to being significantly faster than microfabrication, is low cost and highly scalable, because it can be really conducted in any laboratory setting without specialized equipment. And we can, it's really versatile, because we can fully customize the device geometry and design for any specific application. And we use these devices in a number of epidermal sensing devices. For example, we use them in non-invasive brain recordings, in EMG, as well as in cardiac monitoring. Now, in the interest of time, I will just tell you a little bit about our studies to investigate the suitability of these gel-free MXene electrodes for non-invasive brain monitoring through EEG, and how they compare to gelled clinical electrodes. So in these studies, we place an array of 8 MXene electrodes with the 3D mini pillars on the back of the head without any gel underneath. And at the center of this array, we place a clinical gelled electrode that is commonly used for this application. So the first thing that we did was to measure the impedance between the electrode and the skin, which represents basically how good is the contact between the electrodes and the scalp. And so what we found is that the impedance of the MXene electrodes is very comparable to that of the clinical electrodes, even without, again, any gel underneath. We also found that the brain signal recorded with the 2 types of electrodes is virtually indistinguishable, not only at the representative location, but actually across the entire array. And so now we are really exploring all possible applications of these technologies beyond EEG. I mentioned already EMG, particularly for rehabilitation, as well as for control of active prosthesis, for electrooculography, which means monitoring the retinal movement for attention or fatigue studies, as well as we are scaling down these devices to do invasive recording and stimulation in models of neurological disorders, in particularly pig and rat models of traumatic brain injuries. And so with that, I hope this concludes my talk. I hope that I was able to convey some of the enthusiasm for our research. And if you're interested in learning more about our research work, as well as what's going on in the Penn Center for Neuroengineering and Therapeutics, where a team of engineers and clinicians work together to develop the next generation of technologies for understanding and treating neurological, neuromuscular, and mental disorders, I encourage you to visit my lab, as well as visit my lab website, as well as the CNT website. Thank you for your attention.